Welcome back to my channel. So this vlog is about my junior surgery posting, and junior surgery posting is like a clinical rotation in which is done in fourth year of medical school. But this time around we didn't rotate. Posting started on a Monday, but I resumed on a Wednesday. The only thing I knew was that I was posted in orthopedics F1, but I didn't know anything about the days and what they have and time. So I had to pack everything, both my scrolls, my word codes, so that I won't be at a disadvantage. My friends were also posted in different units from orthopedics, so I really couldn't get the timetable for orthopedics. Orthopedics has F1, F2, F3, and F1 is for fractures, F2 is for spine, and F3 is for children and trauma. So I just had to go to the hospital, and on that same day the nurse introduced us to the different units in orthopedics. We didn't see our consultants for F1, so we had to join F2 in what they were doing, and that Tuesday was their clinic day. In the consulting room, we were given a patient to collect and present to the doctor. So at the end of the day, I left after standing for hours. The next day, which was a Thursday, I had to pack everything because I was yet to see the doctors for the F1 unit orthopedics. And luckily for me, we saw the house officer, which told us that F1 should be in the theater that Thursday. So I had to go to the changing room and change to my scrubs. Thursdays are theater days for F1. I was waiting for the doctors for the surgery, doctors that would do the surgery, and I figured out that my crocs were actually bigger than my feet, even though it's my size. I don't know. That was my first time witnessing a surgery. I felt so excited. I felt so happy, like first time experience. So this is surgical supply room. The doctors introduced themselves and they taught us the theater rules and things in orthopedics. So the surgery ended by 5 p.m. if I can remember correctly. The surgery was on a distal fractured femoral bone. So this was Friday, and that day is ground rounds, and then the next thing we did was ward rounds. They call it business ward rounds because it's just a quick ward rounds by the senior registrar. This is me after running. I literally ran around the hospital looking for the doctor to sign the attendance. This was another clinic day on Tuesdays. That's when F1 unit orthopedics have their clinic days. We didn't collect any patient, we just watched the doctor collect patient, and he taught us to based on the signs and symptoms of each patient. Wednesdays are registrar ward rounds, which is held by our senior registrar, and they are good with African time. So when we come, we have to wait for them for some time before they come and do the ward rounds. Then after the ward rounds, they will have a little lecture with us, teach us some stuff, and then we go back home. This is a Friday, another ground rounds, and ground rounds is like a presentation, a meeting done by doctors from different units. They come to present a topic or something, and then the doctors talk about it. So that's what ground rounds is all about, and it's every Friday. This is another theater day. I think this was the third week of my surgery posting, and we were in this other theater course. Orthopedics has two theaters, a dirty theater and a clean theater, as they call it. The dirty one is where they treat skin infections, anything bone infections, anything infections, they treat dirty ones there. But the clean theater is where they fix bones and fix fractures. So we had to move to this theater because they were shooting x-ray in the main theater that was being used. That's the clean theater was being used at this point. So we had to move away because of the radiations from the x-ray machine. So I just did a little tour of the operating room. This is the last week of my junior surgery posting, and we started having lectures in the morning and lectures after posting. So I had a lecture on upper and lower GI bleeding.
The that good to the activities will not be done effectively carbohydrate metabolism. I'm not going to go through all of those, just the functions of the liver will be affected. What are the clinical manifestations of liver cirrhosis? Early in the disease, you can have just right jaw, upper quadrant pain.
So after the medicine lectures, which ends by 10 a.m., I had to go for my consultant ward round because it's a Monday and Mondays are consultant ward round for orthopedics unit F1. After that, I had to go for my surgery lectures, which last from 1 p.m. to 4 p.m. It's a skincare hall, and skincare is just like therapy for me in this medical school. This was my last day in the theatre. I just wanted to get a good view of the passageway. Surgery unit has a theatre, and all the theatres are located in one place, and orthopedics has theatre 4 and 5. This was the last day of my junior surgery post. My junior surgery posting was really interesting. The doctors were so nice, starting from the consultants down to the house officer. Thanks for watching, and don't forget to subscribe.